Hi everybody, I wanted to talk to you today about something some of you may have wondered about breast augmentation surgery, and that's how plastic surgeons are able to place a fairly substantial breast implant in through a very small incision within a breast to get a nice result with your breast augmentation. Back in the days of saline breast implants, which were in common use prior to 2006, this was not a problem, as the saline implants were completely deflated before they were placed into the breast, and then they were filled with a special fill tube that was removable once the implant was inside. As a result, you could place a small deflated implant in through a very small incision. Silicone implants, though, come pre-filled, and since 2006, silicone implants in North America have largely, if not completely, replaced saline implants. As such, though, this has necessitated slightly larger incisions and a more difficult task in placing a fully expanded implant into a small incision. So the device that I love to use most commonly is something called a Keller Funnel, and I've already got one open here. This is placed in a sterile condition inside an operating room, but it might remind you of sort of a bakery piping bag where icing is delivered in the bag and placed through a small spout in the end of the funnel. And this is basically the same principle. It provides so many advantages to a breast augmentation surgeon, though. It allows us to deliver this implant in a very safe and non-traumatic fashion into the breast. So what that means is that the implant can be washed inside its sterile packaging with antibiotic solution. The implant can then be poured directly into the funnel without ever being touched by the surgeon's or the nurse's gloves, which can potentially reduce the risk of contamination of the breast implant. And then the funnel will allow the surgeon to deliver the implant in through a fairly small incision in a very atraumatic fashion into the breast. As a result, I never have to touch this implant with my gloves, and that decreases the risk of potential contamination. Now, contamination of a breast implant is a big problem. If it becomes contaminated in the operating room, this can result in an outright infection, which would necessitate removal of the implant, or over the long term, perhaps increase the rate of something called a capsular contracture, which leads to excessive scar tissue around the implant. So I find this funnel is a huge boon to my practice by being able to avoid these risks. It also decreases the amount of trauma that is necessary when a surgeon applies pressure to the implant to push it through that small incision. So that means I get better wound healing and better scars. I can also place the implant through a smaller scar. And lastly, there's much less risk of damaging the implant while it's being placed through this incision. So I want to demonstrate to you how this actually works, because it's kind of cool. So the implant in the operating room, it's of course completely sterile and it's inside the packaging. This is just for demonstration purposes, but the implant is placed inside the funnel like so, and then this is the way I'll handle it, with the gloves on the outside of the funnel and the implant loaded inside. And then you simply align this with the edge of your incision, you place it inside, and then with a little bit of pressure, you can see that implant just pops right out. I'll do it one more time for you because it's just so fun to do. So one more time, you just move it right up to the edge and a little bit of pressure, and out it comes. And there you go, the Keller Funnel.